Delighted to welcome Shadow Health Secretary Labour's Wes Streeting to the show now. Good morning to you.
Good morning, Julie.
Good morning.
You sound very cheerful
I'm
today.
very cheerful.
Are you celebrating the NHS's 75th birthday?
Given the NHS is neither a human being nor a pet dog, is it a birthday?
I knew you were going to say that, so I'm just trying to trigger you this early in the morning.
Listen, I'm sorry. No, Wes, sorry, darling. I can't hear you over all the clapping. Oh, it's wonderful. 7.4 million people on waiting list. It's brilliant. 180 billion quid, 44% of our government spending.
I'm glad you said that, actually, because I do think there's an absurd spectacle going on today of ministers turning up at parties, cutting cake and celebrating when the NHS is going through objectively the worst crisis in its history and a crisis of their making in terms of the 13 years that's led us here. In fact, we had the health minister out on the airwaves this morning saying that waiting lists are going to go up. Brilliant. When Rishi Sunak said they would be coming down when he became Prime Minister. So it is going through the worst crisis in its history. I am actually optimistic about the NHS's future, not just because I happen to be an eternal optimist, but because I genuinely think that with the right combination of investment and reform and modernisation, we can have an NHS that's both fit for the future and able to meet the challenge of the country in 2048. But also lives up to its founding principles, free at the point of use, there for us where we need it.
This thing, all of these statements, they sound lovely, and you've been pretty brave as a front-bench Labour politician about how, the NHS isn't perfect, but when you've got the Prime Minister and your boss, Sir Keir Starmer, attending a religious service, a service of thanksgiving in Westminster Abbey today, missing PMQs, both of them, by the way, for a public service that we pay for, does that not tell you part of the problem? The treatment of the NHS as this sacred cow, as opposed to a public service that we pay for through our taxes in the same ways we pay for street lighting and roads and schools and sewers. When we treat it as this sort of thing that cannot be questioned, that's part of the problem.
Well, I think we could all do with praying for the NHS given the state it's in, but we need to do more than offer prayers. We need to offer solutions, and that's what the Labour Party is doing. We have got a plan for reforming the NHS because we know that, particularly with the public finances and the mess that they are, there isn't a huge amount of money going around, but also we know that we've got to make sure the money that already goes into the NHS is well spent. And when I compare our health service to the health services of other countries around the world, and you look at where the money goes, we run pretty much top of the charts in terms of hospital spending, but on primary care, things like GP access, community services, mental health and diagnostics, we're either near the bottom, at the bottom, or seriously lagging behind. So we end up in the worst of all worlds, where because people can't get a GP appointment, which would cost 40 quid, they end up in A&E, which costs 360 quid, which is worse for them and more expensive for the taxpayer. And I could give you so many examples of like that, where it's bad for patients and more expensive, and that's why our approach is about reform and modernisation, not just about more money.
Yeah, I'm not party political on this one. It seems to be very, very clear that there is a cost, but there's also a need for staff. We need to be training people. Cameron and Osborne made some terrible decisions, limiting the number of nurses and doctors who were going to be trained up, and you've got some good plans in terms of that. The trouble is, it'll take about 7 or 8 years for people to come through the system and to be working in the system, and we are in a very, very difficult situation. But the trouble is, when it comes to outcomes, the NHS, when it comes to actually people living longer when they've got very, very bad diseases, they're more likely to be cured in France, in Germany, in Slovakia than they are here. That tells us something. We are now pouring in huge amounts of money. Money may not just be the solution. A bit of reform may not be the solution. It may well be that actually we need something radical. I'm wondering whether you agree with what the Health Secretary himself has had to say. This is Steve Barclay. He said the NHS can prosper without drastic change. He says he's rejecting calls for radical reform, and he says our most treasured national institution needs evolution rather than a big bang. Do you concur?
I think the NHS is going through the worst crisis in its history, and it does need some fundamental change. And I think just as only Nixon could go to China, only Labour can be trusted to reform the National Health Service to make it fit for the future. And I've been pretty appalled, actually, by some of the Tories now popping up saying, oh, we need a royal commission, we need the great and the good to get around the table, and, oh, the reason that the NHS in the state that it's in is because we haven't sat around the table singing Kumbaya together for the last 13 years. Like, we've just had some disastrous Tory reforms like the Lansley top-down reorganisation, which the NHS is still suffering the long-term consequences of. When we were in government, we showed what good reform looked like, and we delivered the shortest waiting times and the highest patient satisfaction in history.
You also
so at the next
brought in
election,
privatisation.
Well, we use the private sector to bring down NHS waiting lists, and I'll be doing that next time round as well, because, as you say, it takes years to train more doctors and nurses. The problem is now we've got a two-tier system where those who can afford it are paying to go private and those who can't are being left behind. I'm not going to stand for that. If there's spare capacity in the private sector, I'm going to make sure that people on low incomes get access to it on NHS terms, free at the point of use, so they don't pay a penny. And I make no apology for it whatsoever.
You don't think we've got lessons to learn?
And the pragmatic thing to do.
You don't think we've got lessons to learn from other countries like France, like Germany, Canada, Australia, all these other countries where there are some payments up front? There's a social system where, you know, people are covered at the bottom of the pile economically, but actually you have to make a contribution towards your healthcare directly. You don't think that the fact that these people in those countries routinely live longer, are cured more quickly, are seen more quickly, get GP appointments on the day, see a consultant within a few days, get their treatment started earlier, and therefore survive when they don't in this country? You don't think that's worth looking at?
I don't dispute they get better outcomes, but I do dispute why they get better outcomes. It's about where you spend the money, actually, not about how you raise it. And I genuinely think that the system that we have is the fairest way to raise the money, potentially the most efficient way of deploying it across the system, because in a world of genomics and artificial intelligence and machine learning, actually the NHS model, a single payer system, could be the most efficient model in terms of procurement, in terms of research into new treatments and technologies, but we don't make the most of that model, and that's the approach I would take.
We shall see, but it's going to be very interesting if we do see a Labour government, as the polls seem to suggest we will from next year, when you're grappling with the same issues, how well that works out. I must ask you about a couple of other stories, though. Partygate, once again, rearing its head, 2 new investigations, one of them involving Sean Bailey, the former Tory candidate for London Mayor, and a party he attended at Tory HQ in December 2020. Also a party organised for the wife of Bernard Jenkins, the Tory MP who was on the Privileges Committee that made that judgment on Boris Johnson over whether he lied to Parliament or not. He is accused of attending his wife's drinks party for her birthday, when gatherings of people, more than 6, were completely not allowed. What do you make of those investigations? Should we continue to see police time wasted, or some people would say wasted, on these issues, or do you think it's vital that people are exposed for hypocrisy?
I think I'd say a couple of things. One is that Sean Bailey should not be taking a seat in the House of Lords. I don't think it's appropriate. I think it's a kick in the teeth, actually, to millions of people who did follow the rules, and often involving great pain and sacrifice in terms of missing funerals, not being by a loved one's bedside, and everything else this country went through. The second thing I'd say is, I think, like everyone else, I'm sick of seeing parties in the headlines, and I hate the way it brings our politics into disrepute. But I think part of
we're exposing dishonesty and hypocrisy from politicians.
We've got to. That's the thing. Well, that's the thing.
Should we not talk about it then? Should we just carry on with the pretense that politicians were obeying the rules when they weren't? No.
I think you're completely misunderstanding what I'm saying. The point I'm making is, I know there are some people who are reading the headlines and kind of going, "Oh, not this again," but I really believe very strongly that we have all got to be held to the same standards. And there were people in Ilford who were fined for attending lockdown parties on the same day they were taking place in Number 10.
Yeah.
They were fined, they faced justice, and everyone else who was involved in Partygate, in politics, have got to face the same penalty as my constituents. Can't be one rule for them and another rule for everyone else.
Wouldn't the actual answer be, here's an idea, that maybe politicians shouldn't vote for and support publicly measures which they know aren't necessary and force them on us ordinary peasants, while you lot are having a great time behind closed doors with your parties?
Well, let me tell you, I wasn't having a great time behind closed doors. And the other thing I'd say is, on this, and I know we have an honest disagreement on this issue, Julia, but what I can say, I think for not just me, I think the majority of MPs who voted for these laws in good faith and abided by those laws, what we did was motivated in terms of what was right for protecting the public and public health. Yeah. I'm sure when the COVID inquiry reports, there'll be things that all of us got wrong and we'll take it on the chin. But I was motivated, and I genuinely think the majority of my colleagues were motivated.
I'm sure you were motivated by it, but you didn't bother doing enough. You didn't bother doing enough research, didn't bother reading the actual data that would have told you what you were doing was absurd and unnecessary. Final question. We've got an issue between various people and their banks at the moment. Nigel Farage exposed last week that Coutts Bank had decided that they didn't want his accounts anymore, wouldn't tell him why. It's since been claimed by a source at Coutts to the BBC, extraordinary breach of his personal information, that he doesn't have enough money for that account. Other Coutts banking customers are saying, we don't have 3 million in our accounts and we're still there. We've seen a parent support group for trans children being blocked from Metro Bank. We spoke earlier to Alexandra Tolstoy, an author and businesswoman who's basically had her account closed, not being told why. This is happening to numerous people. Reclaim Party, Reform UK Party, unable to get accounts. Do you think that banks should be allowed to pick and choose who they give their bank accounts to, depending on the political views of their customers? Well, I think banks are right to have rules, but they've got to be rules that are fair, transparent, and applied equally to everyone, and where we're not discriminating against people on the grounds of their beliefs. I mean, I must say, when I saw the news yesterday that Nigel Farage couldn't get a Coutts bank account because apparently didn't have 3 million quid, I did not rush to, you know, get out the world's smallest violin. I really couldn't care less about his banking arrangements. But what I do care about is that he's treated fairly. And whatever my political disagreements with Nigel Farage, of which there are many, whether it's Nigel Farage or the Nigel that nobody's ever heard of, we've all got to be treated fairly and equally. And so what I would say to banks is that in relation to any customer, whether it is the famous Nigel or the Nigel that nobody knows, you've got to treat them fairly. And if you're not going to provide them with a product, give them a fair and reasonable explanation as to why. OK, as long as the rules are fair. OK, let me give you a scenario, because someone doesn't like someone's political views, but it's applied across the board. Let me just say, let's say we've got a Christian evangelical group, organisation, running a bank, and they find out that you, one of their customers, Wes Streeting, is a gay man. And they say, actually, you know what? We don't want your custom. Is that OK? As long as it's applied to all gay men, is that OK?
No, that's not. No.
Why is that not the same thing?
Misunderstand me on this, Julia. No, what I think you'll find what I said was that people should not be discriminated against on the grounds of their political views either. And so
But it didn't bother you that Nigel Farage was.
No, I said it didn't particularly bother me when the explanation was that he didn't have 3 million quid to deposit in the bank account.
That was what a source told the BBC. It's clearly not the explanation, because that's not happened to other customers.
Fair enough.
You must stop believing the BBC.
Can I be completely blunt and honest with you? I have spent precisely 0 time thinking about Nigel Farage's banking arrangements, so everything you are telling me is new information. I think the principles that apply here, people should not be discriminated against on grounds of their political views, and banks have a responsibility to have rules that are applied fairly and equally to everyone. And if they're not giving Nigel Farage a bank account, I think they owe the guy an explanation as they would any other customer. All right,
Wesley, I'll let you go. Got another interview to get to. Also, can you say hello to Steve Bray for me? He's standing behind the guy with the placards and the mad hat, Steve Bray.
I could feel him, like Julia Hartley-Brewer says hello.
Hello. All right, Steve, carry on annoying the country. Much appreciated.
Bring these two together this morning.
Make a lovely couple. Wes Streeting there. Thank you very much indeed for that.